Hi, this is Dr. Yashaswini Kamaraju. Welcome to Reach Mental Health Awareness Series. Today I'm going to talk about child and adolescent psychiatry consultation. What do you expect when you see a child psychiatrist? So let me first start telling you about child psychiatrists. So child psychiatrists or psychiatrists with expertise in children and adolescents. So they look at developmental problems, behavioral problems, teenage issues, academic issues, a host of things that could happen in children and teenagers. So what should a parent expect before they see a child psychiatrist? So often parents think that when you meet a child psychiatrist, most of the issues are solved in the first session. It's not the case. The reason being, when we talk about a child, for example, when we talk about a 13-year-old child, let's say, we're taking the history for 13 years. How was the child when he was younger? So what happened as the child grew up? So how did the child develop these behavioral problems? When did the problems worsen? So we need to get a lot of history from parents. Second, we also look at the feedback from teachers. So if at all there's a school history or there are problems happening on the school premises, we would like to get that history. Number three, we would also like to see or hear about the issues that happen in the playground while with friends. How are these children socializing? What are the friendship issues that are going on? Number four, how is the child functioning overall? For example, how is the child at school in academics? How is the child coping when it comes to issues with friends? How is the child able to problem solve when there's a conflict with a friend? So all of these things are very much needed for a complete assessment of a child or a teenager. So when a parent comes for a child psychiatry assessment, number one, we're taking a very comprehensive history. Number two, clinical observation of the child, clinical assessment of the child. This happens especially when a child is younger. We are looking at how is the child speaking, how is the child interacting, how often is the child bonding with the parents, how often is the child going to the parents. So we're looking at all these things in the clinical setting. How is the child understanding instructions? If it's a teenager, we're looking at what are the issues that the teenager is facing, how he or she is able to articulate the problem. And when we see teenagers alone first, and then the parents, or parents first and then the teenager alone. So I mean to say that we give separate time for the teenagers. However, there are teenagers who wouldn't open up right away. So such teenagers are requiring a lot more time, and this may not happen in the first session. Whether it's a young child, a middle schooler, or a teenager, most of the child and adolescent psychiatry sessions often have a lot more history and a lot more layers to the assessment, and it's not possible to derive answers in the first session alone. So a lot of times we inform parents to come for the second session or to get other information that is required for a clear diagnostic picture. Also, the second thing that child psychiatrists do is to look at if any other medical tests are required for the child or the teenager. Number three, also to look at any other medical referrals are required. For example, if the child or the teenager is requiring a neurologist consultation, let's say. So such kind of referrals, if required, are also suggested. Number four, an assessment, an overall, a brief assessment could be done in the first session, and some pointers could be given to the parents in terms of intervention. Number five, we suggest psychologists for therapy, talk therapy, parent management sessions, or individual counseling or therapy for the child. So psychologists work closely with psychiatrists, and child psychologists work closely with child psychiatrists so that we understand the child totally and help the child in a holistic manner. Sometimes child psychiatrists would be using medications as well, because there are medications which are approved to use in children and adolescents as and when indicated and as and when required. Medications are also used as a form of treatment. And last but not the least is looking at the family functioning, because in order to in order to help a child, of course we are looking at the family, we are looking at the parents, we are looking at the home environment. In fact, much more in child and adolescent cases, because as you know, a child comes in environments, home environment, play environment, and school environment. So if we have to help a child or an adolescent, we have to look at all these environments. So not only looking at the child, but we also make suggestions in terms of the parenting skills and the home environment, and also the classroom management, because schools is where a child or a teenager spends maximum of their time, and it's very important to look at the school environment and to give suggestions to the teachers and the school. So understand that child and adolescent cases take a lot more time. There is patience, effort, and time involved on both sides, and it's not possible to fix everything in the first session. However, we could definitely get an idea and point you towards the right direction. I hope this information is helpful to you, and I would also suggest you to go through some of the other videos in the Reach Mental Health Awareness series, which throws a light on child and adolescent issues. Thank you so much. See you again. Thank you.